Hey guys, Dr. Paul here. In this video, I'm going to go over a wisdom tooth extraction. It's an upper left wisdom tooth. I'm going to go through why we did the procedure, the things we need to look out for, and then the actual procedure itself, explaining it pretty much from A to Z. So I hope you like the video. If you do, like, share, comment, do all those things. It really helps me out a lot. Enjoy the video. So this patient came to our clinic with pain on her left-hand side. By the way, if you want to just go straight to the extraction, go to the point that I've listed here to see all of that. Now, the pain, she knew it was from the left. She didn't know if it was top or bottom, which is actually quite common with dental pain. So we did a lot of testing. We tested the teeth down the bottom, we tested the teeth at the top, we put cold on them to see how the nerve was responding, we tapped on them. The only tooth that could give us a different response was this wisdom tooth up here on the top left-hand side. Now, the history of this tooth is that it's had a lot of fillings done to it in the past. Because it's so far back in the mouth, it's so hard to clean, so hard to floss, food gets stuck between the teeth. Now the process is when you have food, eventually it gets broken down into acid. That acid causes holes in our teeth. So this tooth had new decay forming underneath an old filling, and I'm going to show you that at the end of the video, which is now causing problems with the tooth. Now we have two options in this case. Option 1, keep the tooth. Option 2, take it out. Now if we keep it, we can actually take out that old filling, put a new one in there. The problem, however, is that because it's been hard to clean previously, it's going to be hard to clean in the future. So the risk we face is that more food's going to get stuck there, it's going to cause a problem again, but it's also going to damage this tooth in front. Do we want that? Not really. Option number 2, take it out. You're going to be sore for about a week, but then you won't have to worry about it again. Thankfully, and it makes sense, the patient chose option 2. Now, I'm going to show you risks that are associated with it, things we have to look out for, and then how to actually take the tooth out.
So this is the x-ray for the patient whose tooth we're taking out today, and this is the tooth specifically. Now for these upper wisdom teeth or upper molars, there's a few things we want to be looking for. Now the first is their actual proximity to the maxillary sinus, which is basically this area here, which is an air-filled space. Now these molars are often very close to it, so when we're taking them out, we have to check how close we are. Now, in this case, I'm going to outline the root of the tooth. You can see we actually do have a gap there. That gap's about 1 millimeter or 2. If we've got 1 millimeter or 2 gap, typically because there is bone that fills that space, we are far enough away to avoid complications. But if we were closer, there's two things that can happen. So number one, when we're taking this tooth out, if the tip of the root breaks, when we try and retrieve that, we can actually push it into the sinus. If that happens, the patient has to be sent to a specialist and it becomes a difficult procedure. So we've got to be careful with that. The second thing is if we are close to the sinus, if we take the tooth out all in one piece, the hole where the tooth used to be can actually communicate with the sinus. Now, if it goes all the way through, any time that there's a change in pressure in the mouth or the nose, it can actually force air through that hole and rupture the sinus. So things like not blowing your nose very hard, letting out your sneezes out of your mouth, don't hold them in your nose, and not using a straw for a few weeks is necessary in these cases where it's very, very close to the sinus. In this case, we're okay. Now, the other thing we have to look at is the bone that's behind this tooth. So this area here that I've highlighted, I'll go back so you can see what it looks like normally in the x-ray, but this area here that I've highlighted, it's called the maxillary tuberosity. Basically, it's a big lump of bone that forms the back of the patient's top jaw. Now, when we've got wisdom teeth like this, it's possible that when we're taking the tooth out, that maxillary tuberosity can fracture. It just makes it very, very difficult. So we want to make sure it doesn't fracture. And especially with a tooth that has very long roots like this, basically how we do that is by taking our time. So we do it slowly, we do hard but forceful, slow movements rather than rushing it. The more you rush it, the more likely to break that bit of bone. So we just want to take our time here. So first things first, we're going to give local anesthetic to the patient. Now before this, I've actually put some topical anesthetic on. And the topical anesthetic is on a little cotton pellet that I put on the gum so the patient doesn't feel the pinch of the needle going in. Now, the actual part where we administered the needle, to make them feel it a lot less, I actually warm up my local anesthetic. I warm it up in a baby bottle warmer. That way it's more like body temperature so they don't feel it as much. The other thing is I'm very slow when I do it. So I come to the site, I put it next to the tooth quite far in, just to make sure that it's going near the apex, so the tip of the root, so the local anesthetic works. And you can also see that I'm wiggling my finger. So that's a distraction technique, just so the patient doesn't feel it as much, and just very slow injection technique. So this technique will numb the outside of the tooth, but we also need to numb the inside of the tooth. So we come here on the side of the tooth, and I'm actually numbing sideways into the gum. So what that does is it actually starts the process of the local anesthetic spreading across towards the palate. So when I actually numb the palate of the tooth, the patient can't feel it anywhere near as much. And again, wiggling the finger again, moving it around, making sure that when I do it, I can see that the gum is going nice and white, which tells me that it's working. So just to give you a little bit of background of what it is when we actually take teeth out, I'm going to show you this image here. So this is that x-ray we were showing you before. Now the bits in pink that I've marked out are actually a ligament, and that ligament is what holds a tooth into the bone. Without that ligament, the tooth is able to come out. So essentially what we're doing when we're taking teeth out is we're stretching and we're lengthening and we're severing that ligament. So when the ligament becomes severed, we're able to take the tooth out. So that's essentially what our goal is. So after the local anesthetic's been administered, then the first thing I do is I take a very fine probe and I feel around the tooth. And I've got two goals. One is I'm feeling to make sure the numbness works. And my second goal is I'm actually starting that process to sever those ligaments. It also makes the patient feel good to know that you've checked before you get started. It gives them some confidence. Now, this is a 3D x-ray of this tooth. So what I'm looking for is any deviations in the root of the tooth. Now we can see at the end there, it's got a bit of a hook, a bit of a curve to it. So, but nothing too drastic. Basically just tells me, take your time. So when we take upper wisdom teeth out, one thing that makes it difficult is access to the area. Because they're so far back, they can be hard to see. But the other thing that impacts us is this bit of bone just here. Now this bit of bone is the front portion of the jaw joint. And when the patient opens up all the way, that bit of bone actually slides downwards right next to that wisdom tooth to make it really hard to get in the way. So rather than the patient opening up all the way, we actually want them to only open up to about halfway and then to slide their jaw across, which gives us the space that we need to go in there. So as you'll see here, I'm trying to get the patient to actually close to halfway, which they have done, and I want them to move their jaw to the left, which can be kind of difficult when you're numb. So that's to the right, and then eventually, yes, there we go, to the left. So what I'm doing is I've got my luxator here. So these are the two instruments that I use. Now these are luxators. So the luxators that I use are both curved, which really helps me get back to those upper wisdom teeth. And the first thing that I do is I use the small one. So the small one gives me those small movements, and how we do it is we drive it up next to the tooth and then twist it, and we lever it backwards. After I've gotten as much as I can with the small one, I'll then switch to the large one, which does the same thing. And often I can get the whole tooth out without having to use forceps with only the large one. And the luxator, I'm basically just wedging it between the tooth and the bone. So you can see that I'm twisting my wrist there, twisting the luxator. Basically what I'm doing is I'm forcing the tooth very slowly backwards. So you can see we're getting some movement of the tooth.
Just quickly pause the video.
Hey guys, if you're getting something out of the video, please like, subscribe, it really helps me out a lot.
Alright, keep watching.
That's those fibers or those ligaments that I was telling you about, they're stretching. So whenever we see that we get that movement, we want to continue that. So I let it on, hold it for a few seconds, let go, twist again, hold, let go, twist again, hold. And until I can get quite a bit of movement. Now these upper wisdom teeth, they tend to come out relatively easily. So I'm just driving my luxator in further and further, getting more of that twisting. So the next thing I do is switch to my larger luxator, and I'm doing the exact same thing. So more movement, and I'm just pushing my luxator up, further up alongside the root of that tooth. Now in some cases we can actually get the tooth out all in one without needing to grab onto it with any forceps. In this case I couldn't do it. These roots are really long, so it wasn't really cooperating with me. I tried to grab it out with my fingers as well, but the gum on the back of it was really holding it on. So in the end, what I did was grab onto it with some forceps, a little wiggle left and right, detach it from that piece of gum that was holding on, and then there we go, we got the tooth out. So here is the tooth now that it's out. This is the filling on the front part of the tooth, and you can see all that black around it where my probe is going. That's the area where the decay was happening on the front part of that filling. Not really a tooth that's worth keeping. She's not using it for any function, and trying to fix that and to help her clean it, it's really difficult, and it's actually going to put the tooth in front of it at risk. So let's just get it out.
Thanks for watching everyone, really hope you enjoyed the video, hope you got something out of it. If you did, like, share, comment. I hope it put your mind at ease. If you're getting a wisdom tooth out, it's not as bad as what you think or what you've heard. Feel free to subscribe, more content like this coming along your way, and remember, keep on smiling.